Mr. Chairman. I want to take a moment to thank all of the witnesses for being here. Because of the gentleman from the state of Washington spoke so passionately and eloquently, I feel like testifying, and maybe the end of my comments, maybe I will testify just a little bit. Now, in my home state, the state where I've been living since I was 23 years old, the state of Georgia, with a Republican governor, and others before this governor had used TANF block grants dollar to fill holes in other programs. Georgia has diverted federal dollars to subsidize other programs and services. They receive awards for cutting programs, reducing assistance, and making it harder to help the working poor. That is not right. That is not fair. That is not just. These resources are to help the poor. Now, I grew up very, very poor in rural Alabama, born in a shotgun house. But in 1944, when I was 4 years old, and I do remember when I was 4, my father had saved $300. And with the $300, a man sold him 110 acres of land. So I know what it is to work in cotton fields, picking cotton, gathering peanuts, pulling corn, raising chickens. And I've seen poverty all across America. It's not just poverty and hunger and people left out and left behind because of one race or one color. African American, yes, whites, Latinos, Asian American, and Native American. We're supposed to be about the business of helping people, responding to the basic human needs, and we're not doing that. We spend too much time talking the talk, but not walking the walk. And I think we must act, we must do something. If we fail to act, history will not be kind to us as a nation and as a people. I've been here now for almost 30 years. The American people are sick and tired, and I'm sick and tired of seeing us not doing something in a significant way. And I want you to tell us what we must do and what we must do now. Not tomorrow, not after this election, but what can we do now to fill the holes, help people? You need health care, basic health care. You need to expand Medicaid in order for people to be able to have the able bodies to work. You can't have sick people trying to work. You cannot have people who cannot receive enough to eat. Let's go on. What should we be doing?
So that was very powerful, and I know this agenda may not quite feel grand enough, but here's what I would say. Healthcare, absolutely. Everybody needs to be healthy in order to work. And if you think about the next generation, about that child who's 4 years old today, the way you were 4 years old, that child needs to have a parent who's healthy and can raise them and can work. I would say investing in children's earliest years, child care programs, early childhood. We're helping the lowest number of people in more than a decade with child care assistance, even though it's incredibly expensive, but it's incredibly important both for parents and for children. I do think that the Congress has done a lot right over the 50 years since those Great Society programs. So part of it is about not doing anything that would take you backwards, right? We have a nutrition program that we know is helping people eat where they weren't eating before, and so part of it is holding on to that. I would also say you have to take on the characteristics of work, of low-wage work. I think we do have to take on the minimum wage and the hours and the leave. And then I would say, and this is a piece where I think I share some elements of the agenda with others here, we have to take on the ability to get training and get education, even if it's 2 years of community college. And we have to understand that today's students are not getting paid for by their parents. They're independent.
Thank you, Ms. Gold. I'm
Thanks.
sorry, time has
I'm sorry.
expired. We're trying to be respectful. Mr. Roskam, you're